Hi guys, I got this question last week from someone that what are the simple exercises that someone can do. Of course, there are a lot of tips which are there which can be utilized, but are there any exercises which someone with a lot of back pain can do? Because a lot of exercises that are told, a lot of exercises that I have also demonstrated previously, are more towards the prevention angle. But are there any exercises that someone with back pain for years can do? The simple answer, short answer is yes, there is. The long answer is let me show you those exercises so that you can do them on your own. Again, like I said, I really don't believe that you should have something complex at all to do. So these exercises are going to be extremely simple, extremely straightforward, no frills, nothing that you need to do additionally at all. You don't require anything, no equipment, nothing, just a mat or a small rug on which you can lie down and do these exercises. But it's important to lie down. The reason is that when you have back pain, it is always a good idea to offload your spine when you're doing some exercise. If you have severe back pain especially, it is important that you are in the lying position when you do an exercise, because standing itself is load on your spine. And if you have a pain of the intensity of, let's say, 6 on 10 or 7 on 10, then that's severe pain, and I would not advise you to do any standing exercises in that time, especially if you are unassisted. And during this time when we are at home, it is critical that you take care of what exercises you are doing and it's the right form. Let me dive right into the exercises and show you what exactly you need to do. First things first, the first two set of exercises are going to be with you lying down on your tummy. So let me show you those exercises. So you're lying down on your tummy, and what you have to do is put your hands right next to your shoulder and then push up on your hands and come up. Now I'm able to come up fully, but you can decide whether you're able to do this fully or you can do a half if you want. If this is too much for you, coming on the forearms is as good. What this does is puts a reverse movement on your spine. The entire day you are mostly bending forward and sitting slouched. So what this posture does is puts you into the reverse position, which is very good for your spine. So the first exercise is coming all the way up. The second exercise is a slight modification of this. If this is too difficult for you, or coming on the forearms is also a little tough, what you can do is modify your hand position. What you will then do is, instead of keeping your hands next to your shoulders, you will keep your hands next to your ears. So right at your ear level and then come up. Milder stretch and not very discomforting at all. How often should you do these exercises? These two exercises need to be done maybe twice a day. And how many repetitions? Start with 5 and then build up to 7, 8 and 10. Try not to go more than 10 if you have severe pain, and once your pain level starts coming down, your exercise will have to be modified. But to start with, you can start with 5 repetitions of this. Try not holding for too long. Hold just for a couple of seconds and go back. The first two exercises are on your tummy. The next exercises are with you lying flat on your back. Let me start out by doing a simple bridge and then 2 other exercises which will be very helpful for you. Let's dive into it. Exercise number 1. In all these exercises, ensure that your belly button is pulled in towards your spine. If you let it relax, then there is no point in doing this exercise, because all your load is going to go on your spine anyway. What you want to do is put in some level of activation of muscles in your spine. To achieve that, pull your belly button straight in, stay here, keeping your hand on your side, lift your body up as far as you can go and come back. How many repetitions? How often? Again, twice a day. Start with 5 repetitions, build up to 10 and then add holding to it. So how you will hold in this is, again, pull the belly button in. Remember to do that. Go all the way up. Stay here, count till 5 and then come back. Remember not to jerk back, come down slowly. This is the first exercise which we will do on the back. The second exercise that we do on the back is what we call as a conventional tummy tuck. So again, pull your belly button in towards the spine. Ensure that your muscles are activated, and then one by one bend your legs, ensuring that your belly button is pulled in. That is the exercise. Pulling the leg all the way up is not the exercise. Pulling your belly button in towards the spine and holding that posture is the exercise. So this exercise sort of activates your core muscles and ensures that you are getting the right muscles to fire to hold your spine in the right position, and it doesn't allow weight to go onto your disc or to your bone and ligaments in the spine. These are the 4 exercises which you can do, 2 on the back and 2 lying on the tummy. There's one more exercise which you can do lying on the side. Let me show you that also. It's again a very simple exercise, but it's important to get the form right. Lying down on your side, you can either have your hand here or keep a pillow underneath, however you want. The second hand will be supporting you here. What is important, like I said, is pulling your belly button in. Extremely critical. This is the exercise. Your leg movement is not the exercise. So pull your belly button in, hold it there, support yourself. Now lift your right knee without lifting your right foot. So you do this. Go as high as you can, maintaining the belly button tucked in, and then go back. And then repeat this. And then do the other side. 5 repetitions to start with, then build up to 10, then build holds. There it is. 5 exercises which are simple, which should be done in lying down, and which will take care of your back even if you have severe back pain. And they are excellent in preventing back pain also. Let me repeat these exercises so that you are sure about what's going to happen and how often should you do these. A quick recap here. I'll start with the exercises on the back now. Lying down on your back, pull your belly button in towards your spine, lift your back up and come down. Start with 5 repetitions, build up to 10 and then add holds. Second exercise, again pull your belly button in. This is the exercise, and then alternately raise your legs up and go back. Going fast in this is not going to help because you have to ensure that your belly button is tucked in. Third exercise, lying down on your side. Again, belly button tucked in and lift your knee up as far as you can take it, keeping this active. This is the exercise, remember, not the movement of the legs. Third exercise, the fourth exercise, lying down on your tummy, hand near the shoulders, coming all the way up. 5 repetitions, building up to 10. Last exercise, hand near the ears, come up. 5 repetitions, building up to 10. That's it. Doing just these exercises will take care of you even if you have, like I said, severe back pain, and you'll be able to take care of your back and ensure that the right muscles are firing and that your spine is in a good position to take care of you. Remember, take care of yourself, stay safe, wear a mask when you're going out, and as far as your back is concerned, do a couple of exercises, stay mobile and don't sit in one spot for too long. Do these exercises, and if you have any questions about them, please reach out to me and I'll make sure that I respond to you. Watch your back and take care.